We're a US company that has now been in the UK for 18 months, focused on delivering the diabetes prevention program. We've enrolled about 45,000 patients into our diabetes prevention program in the US, and just started, we just finished adapting the curriculum for the UK. So the product is designed to address the fact that 1 in 3 adults have prediabetes, which means they have elevated blood glucose, and they have a high risk for progressing to develop type 2 diabetes. And so about 20 years ago, Medicare spent about $175 million on a clinical trial in the US, where they enrolled about 3,000 patients with prediabetes, and they compared the drug metformin to a lifestyle modification program where patients would try to lose 5% of their weight. And they would meet with a health coach covering topics like diet, exercise, sleep, and stress management. And what they found was that the lifestyle intervention resulted in a 58% risk reduction for type 2 diabetes, and that was about 20 years ago. And so today we deliver that program through telehealth and live group video conferencing on Zoom with registered dietitians. So you have a dietitian and 30 patients on Zoom meeting 26 times in a year for 1 hour, going over topics like diet, exercise, sleep, and stress management. And then we issue them a wireless scale so they can track their progress towards 5% weight loss, as well as a Fitbit so they can track their physical activity minutes. And then they can take pictures of their food in the mobile app and get feedback from the dietitian. There's also a way for them to text message with the dietitian as well as the group throughout the week for support, and then set and track lifestyle-related goals in the app. And so we're looking for pilot opportunities now with even 100 patients where we would offer the service for free to prove that we've kind of adapted the curriculum for the UK and that it delivers similar results. Thank you. Any questions?
If I just ask, so you say it's dietitians that deliver your, so trained dietitians that deliver the diabetes prevention programs, is that different to, I guess, other diabetes prevention programs that you're aware of?
Yeah, it's not necessarily a requirement to use a registered dietitian, at least in the US, and I believe it's the same here. They could be trained in a lifestyle coach course, but I think that when you use a registered dietitian, the dietitian could address comorbidities or other issues, like if there's an eating disorder, for example. So I think it makes us different from a lot of the competitors where the clinicians were using or just at a higher skill level as well.
You've got a lot of incumbents and competitors, I'm sure you're aware. What are your main differentiators, I suppose? Just curious.
Yeah, so there's incumbents both in the US and in the UK. Some of our competitors use what's called an online delivery model, where they have these recorded modules of content, and it's mostly asynchronous communication. So a patient might watch some videos or read some articles in an app, but the core intervention is not delivered through live classes. And so we're more of a distance learning approach where every single class is live. So if you think about the original diabetes prevention trial that was funded by Medicare and then brought to the UK eventually, it was based on a group of patients in a physical classroom. So if you think about, well, how do I replicate that online? In our view, you really have to have live classes, because a live class is completely different from, say, a chat bot, which a lot of our competitors use, or recorded content. And I think the patients really get a sense of social support from the live classes. So that's a big differentiator. The fact we use dietitians is different. I think the fact we're using Fitbit is not necessarily used by all the other competitors. And then we're also working on translating this into other languages that are spoken in the UK as well. So I'm not sure that needs fully addressed at the moment as well. Yeah, thank you.
What have you done to adapt your American product to the UK market?
Yeah, so the core thing that we've done so far is adapting the curriculum. So the dietitian uses PowerPoint slides to facilitate the group classes. And so although US English and UK English is similar, it's also very different as well. So we hired a local UK dietitian that had experience in delivering the diabetes prevention program, and she has edited the slides to be more culturally appropriate. Not just edit the language, but there's cultural nuances as well that are different. So we just completed that. I think there's also some structural differences in how the NHS pays for diabetes prevention compared to the US and the UK are just different in terms of how they pay for it. So we're at the last step of really completing that research. I think there's less classes that are delivered here versus the US, for example. But the main thing we finished so far is just adapting the curriculum and making it culturally appropriate.
Does that include things like recipes?
Yeah, down to the level of like what foods are being recommended as well. So
no peanut butter sandwiches?
no, there was some tuna sandwiches and tea, I think. But anyway, any other questions? Yeah.
Can I just ask about kit? Because some of your competitors do or did send out bits of kit.
Sorry, say that again.
So you just mentioned about kit potentially. Do some of your competitors do send out kit to patients?
Oh, like devices and
devices
yeah.
to be able to weigh themselves, like you say,
Yeah.
type stuff. Does yours have any kits that you send out to patients? I shouldn't call
Yeah.
them patients. 'Cause people would be
Participants, normally we call them.
not patients.
Yeah. So we send out a wireless scale as well as a Fitbit that sync with the app, so the patient can see their weight, their steps, their physical activity minutes. In the US, we also have a partner called Modify Health, which delivers medically tailored meals. So if anyone knows any medically tailored meal providers, I think that would be interesting to add. In the UK, we could actually deliver food to patients as well. But typically it's a scale, a Fitbit, and sometimes actual food delivery as well. Yeah.
Just sparked it there. A lot of the UK programs are also tailored to some of the more remission type things.
Yeah.
Like you say, like the kind of shakes type diets, the very low calorie type diets. Do your dietitians kind of offer that as well? So people get to choose whether they kind of do a more traditional diabetes prevention or they actually want to kind of do the proper remission type program?
Yeah, right now we're only focused on pre-diabetes, which is more prevention, but we're thinking about, as a next step, to go into a diabetes self-management education program where the dietitians might also be certified diabetes educators, and then also adding remission. I know some of our competitors do that, but our first focus is just on pre-diabetes and patients that are not diabetic yet. But I think that applying group visits to diabetes management or reversal would show similar benefits in using those group classes, but right now it's just diabetes prevention. Yeah. Someone told me you're a dietitian, I think, so I need your advice.
Let's
Any-
go for one more question. Any more questions? Oh, I saw a hand go up over that question. Yes.
I just wonder about the name because it's something about diabetic with sugar and fruit as misleading. They have no sugar or the factory sugar. When I read the name, and I was because in UK it's lots of we have a lot of don't have your friendly fruit because actually you should have so much sugar. I was wondering whether-
Yeah, no, I've gotten this question probably 1,000 times, but thank you for asking. Yeah, the history of the name is that it's so Fruit Street is the address of Massachusetts General Hospital in Boston, and the company is, that's where the company started, and we have about 500 physicians that invested in the company, and they insisted on naming the company Fruit Street, but I would say fruit is much healthier than a candy bar, so, and Fruit Street is like a journey, you're improving your health, so that's the story behind the name, but we've thought about maybe there should be a different product name, but it's worked so far, but that is the history, yeah. Yeah, maybe Vegetable Street would be better. I mean that's the thing. People eat their fruits, but they usually don't eat their vegetables. So you're probably right.
I like it.
Thank you.
Thank you.